Are you cutting corners? Is there some steps that you're cutting out? It's not that at all. We're using the updated technology, the advanced surgical skills to make sure that the procedure is well planned out and delivered in the most predictable fashion. How does permanent teeth in 24 hours actually work? We work closely with the lab that's literally in the same building that our surgery centers are. Our offices talk to the lab, and they're able to take your surgery, do your surgery, and then present it the next day with your final permanent, beautiful, strong, healthy teeth 24 hours later. It's just you don't have to wait 4 to 6 months to get your permanents. So that's how it works. You can have that quality from day one, 24 hours later, and heal with your permanent final teeth that way. So because it's faster, are we sacrificing quality? Not at all. In fact, we're improving the quality from day one. Are we cutting corners? Absolutely not. We're just delivering high quality permanent smiles in less time. Think about you break your bone, okay? There's nothing on earth that's going to speed up your body's natural process to heal your bones. And we're not doing that either. However, when you get a broken bone, you have to set it correctly for it to heal in the right position and so it functions normally. We don't, at the cellular level, speed that process up. But what we do is you are actually healing with your final permanent, high strength, high quality, good looking teeth from day one. The absence of delivering a temporary prosthesis is not cutting corners, it's actually improving the method. You're not wearing a flimsy prosthetic while you're healing, so you have some flex and it can delay healing, it can inadvertently cause implants to fail. So we don't speed up the body's process, we just make sure that everything is healing in the right positions. You are actually healing with your final permanent, high strength, high quality teeth from day one. And that's how we do it without sacrificing quality.
Permanent teeth in 24 hours is a real game changer, but how much do they cost? I get asked this question all the time. To help answer this one and many more, we put together a free cost and comparison guide. This will make everything nice and clear. You can go ahead and click in the description or right here for your free copy today.
How does the failure rate compare to other surgical procedures? Industry standards for all-on-X procedures tends to stay in the 2 to 5% range across the network. And at Nuvia, we're actually happy to report that our failure rate is actually less than 2%. And that has to do with the surgeon training, the prosthodontic training, the lab training, all these specialties coming together to make sure we accomplish the same goal. And we intend to continue to improve that. Think about the advanced technologies that have come into the field of medicine over the last few decades, right? Other companies are using outdated, slower, analog, traditional methods. They do work, but why sacrifice your time and efficiency for proven methods that improve your quality of life in a much more advanced and reliable way? And that's what Nuvia does, right? We use advanced technology. We gather materials ahead of time that are going to be permanently fixated into your mouth. Things that other companies would delay for several months. That's how we do it faster and better with high quality, is that we prepare using current advanced technologies to accomplish what would take you before 6 months, we can do it next day. Is what we do dangerous? From a surgical perspective, which is what I am, I love that we have in-house CRNAs with our patients. And what does that do for patients? It gives them peace of mind that there's another provider, a very well-qualified provider that is providing anesthesia to our patients that can be there to monitor them throughout the entire procedure while they're sedated. So we have our prosthodontists in-house that are communicating with us. We have our surgeons that are highly trained. We have our CRNAs that are highly trained. And we also have the lab that this is what they do 24 hours a day. This is all they do. So the communication of having everybody in-house makes this actually way less dangerous because everybody knows what each other's doing. If I were somebody that was referring my own parents to this, I wouldn't go anywhere else because of exactly what I've been speaking to. Superior materials right away. There's no need to go through a prolonged phase of temporary healing when it's been proven that this works. Why put somebody through something you don't need to do? Why do this twice, basically, essentially? With a highly skilled team of experts, surgery, prosthodontics, anesthesia, lab. We want people to know that this is an experience that's going to be life-changing, and we want them to know that this is a safe procedure. It's not cutting corners. In fact, you are reducing complications by doing it this way. So hopefully that helps you understand better.